All right, so sounds good. Everyone can hear me okay? Okay, awesome. Well, yeah, thank you for inviting me to be here and speak with you all tonight. I'm just really honored to be asked to talk with you all. I usually teach 18 and 19-year-olds about a lot of the things that we'll talk about tonight that I think are really important for adults, and especially those who have chronic illness or cancer. So this is really honor for me to talk with you all about how relationships influence our health. And so before I dive too deep into things, I want to sort of set the stage with two different scenarios. So imagine first that somebody comes home from work one day or spending time with a friend, and they walk in their door and they just say, "I'm so stressed. I had the worst day. You won't believe what happened to me." And the person sitting at the table could be a partner, a family member, a sibling, looks up at them and says, "Oh, that sucks," and kind of like goes back to their phone and doesn't really pay attention and just asks, "What's for dinner?" You can imagine the person who walked in the door is probably pretty mad. Their blood pressure might be rising, heart rate might be racing, and it could feel like they have this giant weight on their shoulders. Now imagine that same person walks in the door, and instead the person who's sitting at the table says, "That sounds terrible," puts their phone down, stands up, gives the person a hug, and says, "Why don't you sit down, let me make dinner, and tell me all about it." Now you can imagine that person probably feels like they had a giant weight lifted off of their shoulders. So for me, my research really focuses on how we get through our tough times together. My work does typically focus on couples, but my students that I work with often do focus on multiple types of relationships and close partnerships that we have in our lives with family and friends. And so an overarching question that I ask, usually in my work, is how do couples become closer and healthier through hardship while others experience relationship conflict and health problems? So today I will talk a little bit about my background and my research. I'll talk about why we should even study close relationships and health, talk about communication, as well as managing stress together. So I'll definitely provide some suggestions and tips along the way. Some of these slides have a lot more information than I typically include in presentations. So I will definitely, if it's of interest, save this as a PDF and send it so that you all don't have to like worry about taking notes and jotting everything I have down, because some of the slides are a little bit heavier than others. Okay, so yeah, so I am an assistant professor at Purdue University, and I direct the Relationships and Health Lab here. And we have a variety of different studies going on. So my background, I'm a social psychologist. And so I wasn't really trained in clinical psychology or background in like couple and family therapy. That's not my training. It's more in research and social interaction. And then I got some great experience as a postdoc, learning all about the stress response and our bodily responses, including our cardiovascular, immune, and endocrine systems. And there I also learned more about behavioral medicine, managing chronic illness and cancer. And so at Purdue, I've been really able to integrate the different research interests that I have in my team, which is different faculty members. I work with folks at the Indiana University School of Medicine and Cancer Center there as well. But a lot of people behind the scenes are undergrads and graduate students who are helping me with this work, who are passionate about this work. And so a few different things that we focus on are how stress influences the immune and cardiovascular systems, especially in breast cancer survivors and their partners. We look at how survivors and partners manage and cope with their fears of cancer recurrence and stress in daily life. We also focus on older adults and aging couples to see how their emotional and physiological responses change across the day, especially when they have upsetting conversations or positive conversations. We also focus on chronic illness more broadly and how couples talk about chronic illness in daily life, and also looking at how students have navigated the COVID pandemic. It's been really fun to do this kind of work, and I'm, again, like I mentioned earlier, just really excited to talk with you all about it, and more of an audience that's a bit broader than the 18 and 19-year-olds that I typically teach. So why even study relationships and health? So in 2010, there was this really groundbreaking study that put together, it reviewed all these different studies that looked at the different behavioral factors that can influence our mortality. And they found things that are probably not of any surprise to you, things like smoking, alcohol consumption, physical activity, BMI. Each of these predicted mortality rates, with smoking having the strongest effect. They then compared how much our social relationships influence mortality rates. And what they found was that just relationships broadly had a similar impact to these other health behaviors like alcohol consumption and physical activity and BMI. And then when they broke it down to how supportive or how high quality those relationships were, they found that the effects were even stronger than those other health behaviors. And so having a low quality relationship, broad relationship in this case, with family members, friends, the broader social network and partners, having a low quality, low supportive relationship was similar to smoking a pack of cigarettes every single day. And that really was I think the relationship scientists knew this, but now there was really great evidence showing why this is so important to look at social connection and social relationships as key predictors of our health. And so the same authors, a few years later, wrote a report on the importance of advancing social connection as a public health priority in the United States. And so they talked about why this is a social health issue, public health issue. There should be funding that comes along with studying connections between relationships and health. There should be prevention and intervention programs that are focused on fostering connection. And that our healthcare system should really embed our close relationships into it. And I think relationship researchers talked about this for a while. And then we all experienced a global pandemic a few years later that really showed how important social connection is to our health and well-being. And so a few years, so I think within the last year, the World Health Organization launched a commission to foster social connection because we have had a loneliness epidemic and have high rates, especially from childhood through adulthood, of folks saying that they're lonely and they have a lot of disconnection. The US Surgeon General also put out an advisory about how there are healing effects of social connection and that we need to do something about this. And so this was a great call to action to say that we need to start looking at close relationships and social connection as important predictors of our health. And fortunately, I had been studying this for almost 10 years at this point. And so the big question of how do these relationships, these close relationships, help us live longer, healthier lives? Well, my work I've talked about, we'll talk a little bit more about couple relationships, but what I will talk about today is just broader social relationships in general. In these relationships, the findings show that these strong, close relationships are associated with lower perceived stress. So even when you're faced with a stressor, seeing that stressor as less intense, less overwhelming when you have someone else to help you deal with it. Better psychological health, so lower depressive symptoms, anxiety symptoms, distress symptoms, even lower stress hormones. So having a high quality relationship can even help your body, like the stress hormone cortisol or adrenaline. These different hormones in our bodies will be lower if we have someone who is there helping us, supporting us, and providing a close connection. It's even associated with better cardiovascular health. So better, higher heart rate variability, which is kind of like a cardiac flexibility metric, lower heart rate, lower blood pressure are associated with strong and close relationships. even better gut health. So this is sort of like a newer line of research that looks at how our satisfying close connections can help our reduce like what's called gut leakiness, or sort of like toxins going from our intestines into our blood circulation. And having a good support system is associated with lower rates of that. And even lower inflammation, as well as faster wound healing. And this is really important because if we have close connections, someone helping us, being a good friend, being a good person to talk to, can actually help us heal faster when we're sick or when we have an injury. So I'm going to provide some more details on just a couple of studies that are really influential and I think show the importance of the close connection in our health. And so Sheldon Cohen spent years trying to understand why some people get sick when they're stressed while others barely get a sniffle. And so he tested experimentally how stress levels predicted whether people would get sick. And so he and his colleagues actually exposed people to the cold virus, and then put them in a hotel and just measured if they got sick. And so he ended up finding that this graph shows that for those in the green bar, it actually shows that people who were more stressed were more likely to develop a cold compared to the folks represented by the blue bar who were less stressed. And this was in fact that half of the people who were highly stressed ended up developing a cold. So this actually showed that being stressed increased someone's odds of developing a cold after being exposed to a virus. He then wanted to see, okay, well, who tends to be more stressed? Like, what is this thing called stress that's influencing our ability, how likely we are to develop this cold? Well, what he found was that people who were unemployed were more stressed. So that financial distress that we could often experience, especially if you are unemployed or underemployed, and people who are experiencing conflict with family or friends. And this was huge. This was in the early 90s that he first found this, really showing that our broader stress and our stress with others can actually influence our health. And so a few years later, my postdoc mentor, Jan Kiekolt-Glaser, took this one step further and showed how our marital distress could influence our immune system. And so she and her colleagues had couples come to a laboratory setting, to a clinical research center, and she gave them small, non-invasive punch biopsy wounds. And so like actual little teeny tiny wounds that these participants had. And then, top things off, she had them engage in a marital problem discussion where the couples talked about their biggest marital disagreements and tried to work towards some resolution on these disagreements. And then she followed up with them for about 2 weeks to see how quickly their wounds healed. And she found that couples who were more hostile during this discussion in the lab had wounds that healed more slowly than couples who were less hostile during those laboratory discussions. And in fact, she found that the wounds of hostile partners' wounds healed at 60% of the rate of low hostile partners. And so this was a really groundbreaking study because it showed that the quality of our relationships and how we talk to our partner can influence our immune functioning and the risk for and how quickly our bodies heal, which can influence the risk for chronic disease development as well as acute illness. So I was really fortunate because I got to work with Jan years later. So I read that study in graduate school and was just blown away. And then years later, I ended up working with her and I was able to ask a question using her data that just had sat with me for a while after reading that study. And I wondered how couples' typical communication patterns could influence their wound healing. And so she showed what happened in the lab influenced their wound healing. And I really wondered, well, what's going on in day-to-day life? How are these couples talking to each other behind the scenes? And what we found was that couples who mutually avoided discussion, so these were couples that did not want to talk about their issues in daily life, they avoided talking about things together, they actually had slower wound healing than couples who did not avoid those tough discussions. And so this shows that it's not just sort of what we do in a discussion, but even just not talking about it, avoiding it, not wanting to broach a topic with a partner that's important can also wear on our health. And we found that even when the couples used positive behaviors during that lab discussion, so they were doing positive things in the lab, their wounds still healed more slowly if they avoided discussions in daily life. So having one conversation and having it go pretty well didn't really undo this avoidance that they had in everyday life, which I think shows that importance of how we talk to each other in a moment, but also the typical patterns that we have in day-to-day life. And so I want to talk a little bit about when I say communication and when I talk about, okay, positive behaviors, negative behaviors, hostile behaviors, what is communication and what are these specific behaviors that we're measuring in the lab? And so one thing to think about is that we cannot not communicate. And so by being the couple or being a person who's avoiding conversation, like that's still communicating. You're still saying like, I don't trust you, I don't want to talk to you, I don't want to be vulnerable with you, or many other things that another person can interpret because there's no communication, direct communication. Um, and communication is irreversible. So once you say something, you can't really unsay it. Once you do something, you really can't undo it. And so communication is particularly important with our loved ones who we do share these really deep and intimate relationships with. It's also a lot more than just talking. So talking is, of course, important. What we say is important, but there's also how we say things, like the tone of voice that we're using, if we're using eye contact with someone, or if we're looking away at them, the context, like, are we trying to have an important conversation when we are at a community event or with our friends versus when it's just the two of us at home? And of course, these nonverbals as well are really, really important and go beyond, again, just talking. And I also really want to mention that there are gendered expectations in our communication. And so women are often taught and socialized to talk about things, to talk about their feelings, to be the people who have to solve the problems in their close relationships. So if their children are sick, if their parents are sick, if their partners having issues, it is typically identified as the woman to be the person to have to deal with it and figure it out. So that's putting a high burden typically on women in relationships. Whereas men are often not taught to identify emotions or to communicate about them. And so not only might they not know how to really talk about the things that they're experiencing, but they might not know how to talk to somebody else who's also experiencing those emotions. So it can really lead to some disconnect that is just brought in the way that we learn about communication and especially the way that we talk about emotions in our relationships. So I've mentioned the positive and negative behaviors, and we do actual behavioral coding in our lab. So we'll have couples and families come into the lab. Other folks will have friends come into the lab, and they will have them talk about something and actually like code what they're saying or code their specific behaviors for these different positive and negative behaviors. And so this is where I think it gets a little word heavy on the screen. So definitely bear with me a little bit, but I really wanted to provide some insight into what are some common pitfalls that we all do. Like we all do these things, even I know this stuff and I do it too. But what are some things that we could do instead? So one thing that we often see in close relationships, especially among couples, is jumping to conclusions or mind reading. So we will just assume we know what the person's trying to say, but instead we should really sit back and listen. We can paraphrase and we can check our perceptions. So I'm hearing you say this, is this right? Or am I not interpreting that correctly? And a lot of the times we're not interpreting it correctly. And so there's some miscommunication. We often see like blaming, so people blaming one another or focusing on your defense, like not really listening, like how am I going to combat this? Interrupting, or something called yes butting. So this might be someone is talking and you say yes, but so on. And I actually found myself doing this a few weeks ago with my partner. I was like, oh my God, I'm yes butting. Like I am doing the thing. Let me stop and just listen. Listen to what you have to say, hear them out. And if there is usually we do have to apologize for something and accept responsibility. So I apologize for jumping to conclusions and not talking and talking over my partner, and let them talk instead. Cross-complaining. And so this is when we respond to someone else's complaint with our own complaint. And so we don't really address either of them. And so instead, you can validate someone's complaint, like, I hear you, I understand, and I'm sorry that I did that. And you can show empathy and understanding. And then move on to something else if you also have a complaint that you'd like to state. Another pitfall that we see is raising your voice and speaking in a hostile tone of voice. And so sometimes people's voices can like escalate, especially if you're already stressed and someone's coming at you and you might get more stressed. And then so it's important to realize that, to have some self-awareness and to feel your body. If you feel it getting hot, you feel your voice raising, to really just take a minute, take a breath. And if you need a break, it's okay to take a break. Using terms like always and never. These are things that are hard to undo. But even once you like know this, it's hard to unhear it too. So this happens like a lot of TV shows too. People use all like TV shows. These are just like, I feel like storylines in every Grey's Anatomy episode that I'm a fan of. But every time I'm like, that's just a communication issue. Like they didn't finish their discussion, or there's a lot of cross complaining. And there's a lot of like always and nevers. And so you're always late, you're never on time. It makes it really easy for the other person to give an example of, well, I was on time last week. So instead of talking about the issue, they're coming up with examples of why they were on time or why something is inconsistent with what the other partner is saying. So instead, just being really specific and how you felt about it. So last week, I was upset when you were late to dinner because we had a reservation and we had 10 minutes, otherwise we were going to lose the table. And I was really sad when we lost the table. So being really specific about what happened. I think there's two more. So insulting, degrading one another, using sarcasm. So like sometimes making a joke. While it might be funny, it's oftentimes not the best thing to do in a tough conversation. And so instead, really just respecting one another's opinions, even if you don't agree with them. You might understand like, okay, I can see why you said that, or I understand how you must be feeling. I get that. Those kinds of things can really help keep a conversation going instead of making it even more intense. And the last thing I wanted to mention here for these tips is shutting down or storming out. So sometimes like the conversation, you're like, I'm done. I can't have this conversation anymore. Or you see it in movies all the time, like somebody like leaves the house and they go for a drive. This is okay if you talk about it. So if you say, I am feeling really upset, I don't know how I'm feeling or what I want to say, and so I just need to take 20 minutes and then I want to come back. I want to come back to this conversation because it's important to me and you're important to me. But I just need a little bit of time to calm down and figure out what I want to say. So that is okay. So why does this matter again? Like, why am I saying all of these different communication tips? Well, it's because these different negative behaviors increase while these positive behaviors can decrease psychological distress, our heart rates, our blood pressure, inflammation, stress hormones, and wound healing length. And so it's really important for our bodies and our health to have this positive communication. And especially because what we do influences one another. And so I want to talk a little bit about this communication in the context of chronic illness and cancer. And so there's been some really great work done among couples and families coping with chronic illness and cancer. And it's mostly because we rarely cope with chronic illness alone. And instead, most folks are coping within a broader support system, whether they're their families or their community. But this course, changes depending on where someone is at with their chronic illness. So something like cancer, when you're in treatment, potentially might be having more consistent contact with different groups, seeing a doctor more often. But once treatment is completed, some of those connections and the frequency of getting support might not be as often. And especially some of the work that I'm doing right now with couples in survivorship, we're really focusing on how couples are kind of reconnecting after finishing treatment, and how they are navigating that on a day-to-day basis. But broadly, when thinking about how we talk about chronic illness and cancer with our loved ones, how we see a chronic illness is really important. And so something that's been identified within a family system is something called like a we stress or a we disease. So this is called like a shared illness appraisal. And so this means that you're seeing the chronic illness or cancer as something that you can manage together. And so it's not just yours, it's not just mine, it's ours. We are going to cope together, we're going to problem solve together, we are going to be a team and work together on this. And when couples and families have this sort of we perspective, it can actually promote more positive communication strategies. And so some of these strategies might include something called relationship talk. So this is talking about how the chronic illness or cancer affects the relationship. So maybe hopes and dreams might have changed. Maybe vacations might have changed. Day-to-day living might have changed. So really just talking about how that influences each person. And then self-disclosure. So self-disclosure is probably one of the most important communication strategies to help promote really happy relationships. Regardless of whether it's with a partner, a family member, a friend, it really builds emotional intimacy. And what this is disclosing thoughts, emotions, and feelings with someone else. And in this case, it's about the chronic illness or about cancer. So sometimes, a lot of times, we want to protect someone, and so we don't tell them all the information. We don't want to be a burden. We don't want to burden them with this information. And this is often called protective buffering. And so we're really trying to help somebody by not telling them something, but that actually has negative consequences, because then the person's not being open about what's going on, and so they're sort of facing it inside. And they're not communicating what they need and what their expectations might be with somebody else who wants to help. And so instead of trying to buffer, protect a partner, instead self-disclose. So talk about how you're feeling. And then the partner can also self-disclose. And so this creates this nice culture of mutual self-disclosure where people feel like they can talk with one another and be vulnerable with one another. But it's also can be tough because it increases vulnerability, and especially when there's like a stigmatized issue that you might not feel comfortable sharing. So of course, this is information you really want to talk with somebody who you feel who's trustworthy, but it does help build that relationship and help maintain it. And this can help with dyadic coping. And so dyadic coping is very similar to like individual level coping, but it's dyadic in the sense that somebody else is involved. And so it could be somebody filling prescriptions, calling doctor's appointments, going to doctor's appointments with you, having somebody to call after the appointment to sort of process what just happened. So having somebody to be there with you together. But unfortunately, it could be negative too. So somebody like helping, but doing so insincerely could be a way that can sort of hurt the person and make them not want to be so involved them as much in the care. And this can actually promote relationships. And so being satisfied, feeling close with one another, and for more intimate partners, having an increased sexual satisfaction. And so the way that we cope, the way that we see chronic illness, talk about chronic illness is really important for our relationships. And again, why is relationship satisfaction even important for cancer survivors? So my work over the last several years has really focused on this question. And over several studies, we have found that when over the course of diagnosis, through the end of treatment, and in the few years after treatment has ended, survivors, when they felt more satisfied with their relationships, they had lower stress, they were less fatigued, They had lower depressive symptoms and even had lower inflammation and gut leakiness, really showing how that satisfying partnership can get under our skin to positively influence health. And is satisfaction important for their partners too? My research says yes, it does. It is important. In the study that we're doing right now, we're still working on it, but our initial evidence is suggesting that for both survivors and their partners, the more satisfied they are with their communication, so they're happy with their communication, and the less distress they feel in their relationship. Each person reported sleeping better, having better physical health, better psychological health, and they were less fatigued. And then we also looked over time, and we found that when people were more satisfied earlier in the month, that later on, they also reported having lower stress and physical health symptoms on a day-to-day basis, again, for both survivors and their partners. And so I want to put this all together and talk about why is this important to look at stress and health from a couple and family level perspective. So first, it informs prevention and intervention. And so I started this talk showing that, that meta-analysis of our relationships having just as strong an impact on our mortality as smoking a pack of cigarettes a day. And how? How does this happen? We just talked about these different ways that relationships can get under our skin for better or for worse. And in addition to monitoring our health behaviors, monitoring our alcohol consumption and our sleep and our distress, we can do that along with and alongside people who are important to us in our lives, as well as focusing on prioritizing those close relationships in our lives. And so prevention, I think about when I work with doctors, like medical doctors, they ask, well, what do you want me to do with this information? If they're a preventative health care doctor, I might say, well, in addition to asking for someone's marital status, maybe you could also ask just their relationship status or how satisfied they are with their relationship, as well as how many friends and family they have that they can count on and how close they feel to those family and friends. So looking beyond and with our greater social network and support systems and seeing who could be there to help provide support in times of stress. And if people are struggling in any relationship, linking them to care and helping strengthen that, just as someone would if they were smoking or drinking or had some other behavioral health issue, again, intervening on their relationships to help promote it. This also means that we can help loved ones can mutually assist one another. So this is involving each other in the care process. So for someone going to the doctor, having somebody go with you, having somebody be there to ask questions of the doctor, to think about a care plan together, to manage a chronic condition together, and to really treat it at this family system so that people can work together rather than just this individual level system. Because we might have a doctor tell us, we need to do X, Y, and Z when we get home and for the next few months. But if we go home and our partner, our children, our parents, whoever is living with us says, yeah, I'm not interested in changing the way that I eat, or I don't want to go for a walk after work, that means that person might be less likely to also do those things. And so for treating people at a family couple level unit means that those folks are also going to be invested in managing health together. And it also can mean that there's professionals are there to help enhance this. So not expecting people to be able to go home and say, or for you all to go to a loved one and say, well, I learned that it's important for you to be involved in my health management and my healthcare. But instead, having a professional who can sit down and talk with people about how to involve one another. There might be somebody who wants to talk to a loved one about this, but again, they don't want to be a burden. Or there might be someone else who wants to be involved, but they don't want to overstep. And so being able to have a professional facilitate those conversations can take that burden off of the people themselves and turn it into more of a teaching and healthcare-based conversation. So, how can we maintain good health and manage stress with our loved ones? Well, yes, there's all those important health behaviors, right? We do want to exercise and eat well and develop good sleeping habits, but it's really good to do these things together. So, if you have a friend, a family member, a partner, to cook dinners with, and to go try a new exercise class together, or go for a walk together, talk about your sleep habits together. This can actually help build and maintain and sustain that health program. In fact, when one partner decides to quit smoking or eat better, the other partner is more likely to follow suit. So we're really doing this together, and our behaviors actually change together as we get older with those around us. But in addition to all those things that we do, these different health behaviors, I also think about the way we interact with our loved ones as health behaviors as well. So talking about those disagreements, something that's on your mind, talk about it before it gets big. Work together to manage it. Talk about your stress, worries, and cancer concerns. It can be hard to be vulnerable, but it's also important. Even just today, a friend was texting me. This is not a cancer concern. This is much smaller, but friend was texting me and I had missed all of their texts, and I was going to just say, sorry, it's been a busy day, and kind of respond. And I decided to say, sorry, I have a big presentation tonight and I've been really working on it, and I'm a little nervous. And then she ended up responding in a really kind way that made me feel good. So I was vulnerable with her, and she then responded in a way that I really needed in that moment. Increase awareness and look for stress signals in others. And so if you have a loved one or a friend who, they've been hunched over, their voice, like you can hear it in their voice, they just don't seem like themselves. Check in and kindly ask, like, hey, what's going on? What's on your mind? And look out for one another. Taking time to connect and trying new activities. So for me, I always have semester-long professional and personal goals. And my personal goals this semester are to make sure that I spend time with friends at least twice a week. And this was not something I did my first few years here, and now I am seeing noticeable differences in how happy I feel on a day-to-day basis. And so I make sure to schedule plans with someone, and we usually make dinner together, watch a show together, and we also, try new activities. You can try a cooking class, an exercise class, go dancing, lots of fun things that we can do with our loved ones. And always make sure to protect your peace. Prioritize your self-care and your self-soothing activities. It can be as simple as lighting a lavender candle and sitting next to it with a fuzzy blanket if that makes you feel good. So something that is self-soothing to you. And seek help if you need it. So there's individual level therapy, but couples and family therapy is really effective. Sometimes it's really stigmatized, like you have an issue if you go to therapy, especially couples therapy, but it's really effective, and most couples benefit from learning communication tips. I do understand, though, that it is not typically covered by insurance, which again is why intervention and prevention needs to look at close relationships as health preventative, because then this would be covered by insurance, and really making sure that all couples have access to something that's so important for our health. Okay, so I will just thank my collaborators, my funders for the work that have helped with this work, the participants and the couples who have been such great assets to the studies. I want to also mention the lab. So we have a Facebook page, an Instagram page. So a lot of my students will create content on our Instagram, and we post about once a week, anything about relationship, stress, and health. Here are my students presenting at conferences, and us at our fall gathering alongside my cats, Peach and Mango. And I want to thank you all for listening and for being here. And I am happy to take any questions at this point.